So this is actually a nice short exam question to actually ask in an exam condition. You just ask the student, what is an abscess? All right. Or you could say define an abscess. Do you understand how the thing goes? All right. So what is an abscess is what we're trying to answer in this lecture. Okay. So everybody already knows an abscess, and you know that abscess is basically what collection of pus. All right. But let's see how we can be able to apart from the definition, let's talk about different other things, okay? Like the characteristics, types, do you understand? Causes and treatments, okay? So talking about what an abscess is, you already know, okay? Collection of pus inside the tissue, okay? Collection of pus inside the tissue, okay? So that abscess is actually a pocket of pus, like pus is now gathering in one place, so you could say it's like a pocket, okay? So it's like a pocket of pus that forms as a result of a bacterial infection. It is actually a collection of dead tissues. These dead tissues, there's also bacteria there, okay? And there are some white blood cells that actually went to that region to fight the bacteria, okay? So there was like a war there, okay? Now this war led to the bacteria being there, dead tissues being there, white blood cells being there, okay? So they actually accumulated there in response to an infection, right? Talking about the characteristics, of course, if you see abscess like this, it's swollen up, right? That area of the skin is like more than the other areas of the skin. So it is painful, swollen, and tender to touch. It is red, inflamed around the affected area. And if you touch an abscess, you see that what the temperature there is kind of like warmer than the rest of the body, okay? So an abscess is warmth and has some heat around the abscess. There may be pus or discharge, okay, that will be present. There will be fever, chills, or general feeling of illness. That's the malaise, right? I'm talking about the types of abscesses, like different areas of the body where you can have abscess. You go have abscess in the skin, okay, skin abscess. You go have internal abscess, that's in any organ or tissues inside the body, like liver, lungs, brain. You go have dental abscess, which is very common. If you have a poor oral hygiene, okay, you have dental abscess. All right. Then you could have some perianal abscess. We spoke about perianal abscess when we were talking about what? The anal fistulas. All right. So then talking about the causes, it could be due to what? It could be due to some bacterial infections. It could be some infected wounds or cuts. It could be infected teeth or gums. All right. The organs, that's the internal organs, may be infected, or tissues may be infected. It could be due to because you have a poor hygiene. Okay. Okay. Then talking about treatments. If you have all this infection, you have all this discomfort, redness, inflammation, increase of temperature and all that, you might want to treat that, right? So if it is a bacterial infection, you can give what? Antibiotics to combat it. If it's a fungal infection, you give antifungals. If it's a viral infection, you give antiviral infections and drugs, right? Then you can also what? Incise, okay, to drain the pus, okay? So the two types of incision is what? Linear incision and crochet incision. I have videos coming on that. They could do pain management by analgesics. There could be wound care and dressing. They also address the underlying cause, such as what? If it's a dental issue or if the person has a general weak immune system, you kind of like what? Tackle it. Okay, so that's it about what is an abscess, okay, or definition of an abscess. Then we went on to talk about the characteristics, types, causes, treatment, and everything. Okay, so that's it. Bye for now.